In the summer of 1889, the dusty frontier town of Milbrook, Colorado, population 347, had never seen a woman doctor. They'd never imagined one either. So when Dr. Catherine Kate Sullivan stepped off the Denver and Rio Grande Railroad car carrying nothing but a worn leather satchel and a carefully forged nursing certificate, she made sure they never would. What the townspeople didn't know was that hidden beneath her modest nursing uniform was one of the most prestigious medical degrees from Johns Hopkins University, and a secret that could either save their lives or destroy her forever. Before we jump back in, tell us where you're tuning in from. And if this story touches you, make sure you're subscribed, because tomorrow, I've saved something extra special for you. The morning sun cast long shadows across the wooden platform as Kate Sullivan adjusted her starched white nursing cap and smoothed the simple gray dress that marked her as a frontier nurse. The Denver and Rio Grande locomotive hissed steam into the thin mountain air, its whistle echoing off the rocky cliffs that surrounded Milbrook like protective arms. Kate gripped her leather medical bag, the one item she couldn't bear to leave behind, and stepped onto the weathered planks that served as the town's railway station. Milbrook stretched before her like a scene from a dime novel. A single dirt road lined with false-fronted buildings, their paint peeling under the relentless Colorado sun. The Silver Dollar Saloon stood next to Henderson's General Store, while the Milbrook Hotel's crooked sign creaked in the mountain breeze. Behind the main street, modest wooden houses climbed the hillside in irregular rows, their gardens struggling against the altitude and harsh winters that defined life at 8,000 feet above sea level. "You Miss Sullivan?" A gruff voice interrupted her assessment of her new home. Kate turned to see a stocky man in his 50s approaching, his weathered face bearing the permanent squint of someone who'd spent decades working under the mountain sun. His calloused hands and the dust on his clothes marked him as a miner, one of the hundreds who worked the silver claims that had given birth to Milbrook 15 years earlier. "Yes, I'm Catherine Sullivan. You can call me Kate." She extended a gloved hand, noting how his grip was firm but respectful. In Boston, men like this would have tipped their hats and looked away, uncomfortable with a woman who carried herself with professional confidence. Here, his handshake felt like an evaluation. "Tom Bradley. Town council sent me to fetch you. Doc Hartwell's been expecting you for weeks." Tom hefted her single trunk onto his wagon with practiced ease. "Hope you're prepared for what you're walking into, miss. This ain't Boston." Kate settled onto the wagon's rough bench seat, her medical bag clutched firmly in her lap. "I'm quite prepared, Mr. Bradley. I've worked in challenging conditions before." The lie came easily now, after months of practice. She'd never worked anywhere as a nurse. Her 3 years at Johns Hopkins had been spent in surgery, theaters, and teaching hospitals, learning to diagnose pneumonia and perform appendectomies, not to follow doctor's orders and change bedpans. As they rolled down Main Street, Kate studied the town with the clinical eye that medical training had given her. The general store's porch sagged under the weight of mining equipment and sacks of grain. A group of children played in the dust beside the blacksmith shop, their clothes patched but clean, their laughter carrying the high, clear notes that only mountain air could produce. Women in simple dresses moved between the buildings with the efficient purposefulness of people who had learned to make do with less. Kate's trained gaze also caught details that others might miss. The slight yellow tinge in an elderly man's eyes that suggested liver problems, the way a woman favored her left leg as she climbed the hotel steps, the persistent cough that echoed from the open door of Murphy's saloon. Even in this brief journey through town, she could see a dozen medical issues that likely went untreated or poorly managed. "That's Doc Hartwell's place," Tom said, pointing to a 2-story building that stood apart from the others. A hand-painted sign reading, "Dr. Marcus Hartwell, physician and surgeon," hung above a wooden door that had been painted white sometime in the distant past. The building looked solid compared to its neighbors, with glass windows instead of oiled paper and a proper stone foundation. Kate felt her stomach tighten with familiar anxiety. Dr. Marcus Hartwell represented everything she'd spent the last 6 months trying to escape. The medical establishment that had made it clear no hospital, no practice, no patient would accept her as a physician simply because she was a woman. The irony wasn't lost on her that she was about to work for another male doctor, pretending to be his subordinate while possessing skills that might rival or exceed his own. The door opened before Tom could knock, revealing a man in his early 40s with prematurely gray hair and tired eyes. Dr. Hartwell wore a clean white shirt and dark trousers, but Kate noticed the slight tremor in his left hand and the way he braced himself against the doorframe, signs that suggested either illness or injury that he was trying to conceal. "Miss Sullivan, thank Providence you're finally here." Dr. Hartwell's voice carried the educated accent of someone trained back east, though years on the frontier had roughened its edges. "I was beginning to think the agency had forgotten about U.S. entirely." Kate stepped forward with the deferential posture she'd practiced for months. "I apologize for the delay, Doctor. The train connections from Denver were challenging." She handed him the carefully forged nursing certificate that had cost her 2 months' savings to obtain. "I'm ready to begin work immediately." Dr. Hartwell examined the document with the quick efficiency of someone accustomed to evaluating credentials. Kate held her breath, knowing that a real medical professional might spot inconsistencies that would expose her deception. But Dr. Hartwell simply nodded and gestured for her to enter the clinic. The interior was more impressive than Kate had expected. The waiting area held 6 wooden chairs and a small table stacked with months-old newspapers from Denver. Through an open doorway, she glimpsed an examination room equipped with a proper medical table, glass-fronted cabinets filled with instruments and medications, and most surprisingly several medical texts that she recognized from her own studies. "Tom, thank you for collecting Miss Sullivan. Please let Mayor Patterson know she's arrived safely." Dr. Hartwell waited until the miner had departed before turning his full attention to Kate. "I must be frank with you, Miss Sullivan. This position is more challenging than the agency may have indicated." Kate maintained her carefully practiced expression of professional interest while her mind raced through possibilities. Had he somehow discovered her real qualifications? Was he testing her nursing knowledge? "I'm prepared for whatever the work requires, Doctor." Dr. Hartwell moved to the window that overlooked Main Street, his movements careful in a way that confirmed Kate's suspicion about his health. Milbrook serves not just the townspeople, but mining camps scattered throughout these mountains. We see everything from routine childhood illnesses to industrial accidents that would challenge surgeons in Denver. The nearest hospital is a 2-day ride, assuming the weather cooperates. He turned back to face her, and Kate saw something in his expression that made her pulse quicken. A combination of desperation and hope that suggested her arrival meant more than just additional help. "Miss Sullivan, I need to ask, how comfortable are you with expanding your duties beyond typical nursing responsibilities?" The question hung in the air between them like a challenge. Kate realized this was the moment that would define her entire experience in Milbrook. Too much eagerness might raise suspicions about her qualifications. Too little might cost her the position that represented her only chance to practice medicine, even if it meant hiding her true training. "I've found that frontier conditions often require flexibility in professional roles," Kate said carefully. "I'm willing to take on whatever responsibilities you feel are appropriate, within the bounds of my training and capabilities." Dr. Hartwell studied her face with the intensity of someone trying to read character rather than just hear words. "The truth is, Miss Sullivan, I've been managing this practice alone for 3 years since my previous assistant returned to St. Louis. The workload has become difficult to handle independently." Kate noticed how he avoided mentioning the tremor in his hand, the slight weakness in his left leg that she'd observed. The way he sat down whenever possible, as if standing required significant effort. Her medical training suggested progressive neurological deterioration, possibly multiple sclerosis or early Parkinson's disease. Dr. Hartwell wasn't just overwork, he was slowly losing his ability to practice medicine effectively. "I understand, doctor. I'm here to provide whatever support you need." Kate's response was professionally appropriate, but internally she was calculating the implications. If Dr. Hartwell's condition continued to worsen, she might find herself taking on increasingly complex medical responsibilities, while maintaining the fiction that she was merely following his orders. "Excellent. Let me show you the rest of the facility." Dr. Hartwell led her through the examination room to a smaller space that served as both his office and a makeshift surgery. The surgical instruments were clean and properly maintained, though. She noted several pieces that were outdated by Boston standards. "We keep emergency supplies here, laudanum for pain, chloroform for surgery, various medications for common ailments." Kate examined the medical supplies with professional interest, automatically cataloging what was available and what was missing. She noticed an impressive collection of surgical instruments, including some designed for procedures that most frontier doctors wouldn't attempt. "You perform surgery here regularly?" "When necessary. Gunshot wounds, mining accidents, complicated births. We can't always wait for transport to Denver." Dr. Hartwell's tone carried the matter-of-fact acceptance of someone who'd learned to work beyond the normal limits of his training. "I trust your nursing education included some surgical assistance?" "Yes, doctor. I'm familiar with surgical procedures and sterile technique." Kate's answer was technically true, though it drastically understated her actual surgical experience. During her final year at Johns Hopkins, she'd assisted with dozens of operations and had even performed several appendectomies under supervision. "Good. We'll start you with routine duties, patient intake, basic treatments, medication preparation. But I want you to observe everything. The more you understand about our procedures, the more valuable you'll become to this community." "Doctor." Hartwell showed her to a small room behind the clinic that would serve as her living quarters. The space was simple but clean: a narrow bed, a washstand, a small wardrobe, and a window that looked out toward the mountains. "Mrs. Patterson from the hotel provides meals, and you're welcome to take your supper with the other boarders if you prefer company. Milbrook can be lonely for someone accustomed to city life." As Kate unpacked her few possessions, she reflected on the careful balance she would need to maintain. Too much medical knowledge displayed too quickly would raise suspicions. Too little competence would fail to serve the community that desperately needed skilled medical care. She would have to learn to practice medicine while pretending to practice nursing, to save lives while hiding her qualifications to do so. That evening, Kate walked Main Street as the sun set behind the western peaks, painting the sky in shades of gold and purple that she'd never seen in Boston. The air carried the scent of wood smoke and cooking food, mixed with the metallic tang that came from the silver mines. Miners returning from their shifts nodded respectfully as they passed, their faces bearing the permanent coal dust that marked their profession. At Henderson's General Store, she introduced herself to Margaret Henderson, a woman in her 30s with intelligent eyes and the confident manner of someone who'd learned to manage both business and family on the frontier. "Welcome to Milbrook, Miss Sullivan. Lord knows Dr. Hartwell needed help. Man's been working himself to death trying to care for everyone from here to Silver Creek." Kate accepted a cup of coffee and listened as Margaret described the town's medical needs: difficult births in the isolated mining camps, industrial accidents that required immediate surgery, childhood illnesses that could turn deadly without proper treatment. "We lost little Mary Patterson last winter to pneumonia," Margaret said quietly. "Doc did everything he could, but by the time they brought her down from the mountain camp, it was too late." The conversation reinforced Kate's growing understanding of her situation. Milbrook desperately needed more medical expertise than one aging, possibly ill doctor could provide. But admitting her true qualifications would mean risking everything: her position, her safety, and possibly her life. In 1889 Colorado, a woman claiming to be a doctor would face ridicule at best, violence at worst. As Kate returned to her small room behind the clinic, she pulled out the one item she'd risked bringing from her previous life: a leather-bound copy of Gray's Anatomy, inscribed to Dr. Catherine Sullivan, with hopes for a brilliant career in medicine from her favorite professor at Johns Hopkins. She ran her fingers over the inscription, remembering the dreams that had sustained her through years of study while male classmates made it clear she wasn't welcome. Tomorrow she would begin the most challenging deception of her life: practicing medicine while pretending to be a nurse, using her skills to save lives while hiding the education that made it possible. She would have to be brilliant enough to make a difference, but not so brilliant as to raise suspicions about her true qualifications. Kate placed the anatomy book in the bottom of her trunk, beneath layers of modest nursing uniforms. Like her medical degree, it would remain hidden until circumstances forced her to reveal the truth. She had no way of knowing that within 6 months, a deadly epidemic would sweep through Milbrook, creating exactly those circumstances and forcing her to choose between maintaining her deception and saving dozens of lives. For now, Catherine Sullivan was just a frontier nurse who'd come west to serve a community in need. The brilliant young doctor who'd graduated summa cum laude from Johns Hopkins would remain buried beneath layers of deception, waiting for the moment when Milbrook's survival would depend on her courage to finally tell the truth. Preparing and narrating this story took us a lot of time. So if you are enjoying it, subscribe to our channel. It means a lot to us. Now back to the story. Kate's first week in Milbrook tested every aspect of her carefully constructed deception. Her days began at dawn when Dr. Hartwell would review the patient's schedule, his hands trembling slightly as he turned the pages of his appointment book. Kate quickly learned to anticipate his needs, preparing instruments and medications before he asked, a skill that came naturally from her surgical training but which she had to present as eager nursing intuition. "You catch on remarkably quickly, Miss Sullivan," Dr. Hartwell observed on her third morning as she efficiently organized the examination room for the day's first patient. "Most nurses take weeks to understand my preferences." Kate felt a flutter of panic at the compliment. "I've always been observant, doctor. And frontier medicine requires adaptability." She was learning to deflect praise that might raise questions about her seemingly intuitive medical knowledge. The morning brought their first real test: a mining accident at the Silver Strike claim. 3 miles up the mountain, Tom Bradley burst through the clinic door just after 8 o'clock, his face grim with urgency. "Doc, we got a man down at the mine. Beam collapsed on his leg. They're bringing him down now, but it don't look good." Dr. Hartwell immediately began gathering surgical supplies, but Kate noticed how his hands shook as he tried to organize the instruments. The tremor that had been barely visible was becoming more pronounced under stress. "Miss Sullivan, prepare the surgery room. We'll need chloroform, extra bandages, and—" He paused, confusion flickering across his face as if he couldn't remember what else they'd need. Kate stepped forward with practiced efficiency. "Bone saw, surgical needles, catgut sutures, and morphine for post-operative pain, doctor." She phrased it as a question, though her medical training told her exactly what would be required for a potential amputation. "Yes, exactly." "Good thinking." Dr. Hartwell's relief was palpable, and Kate realized she'd just covered for a moment of medical confusion that could have been catastrophic for their patient. 20 minutes later, 4 miners carried in a man Kate later learned was called Dynamite Pete, though his real name was Peter Mackenzie. The nickname came from his expertise with explosives, but today his knowledge hadn't saved him from a rotting support beam that had given way without warning. Kate's first glimpse of his leg told her everything she needed to know. Compound fracture. of the tibia and fibula, significant tissue damage, and almost certainly compromised blood supply to the foot. Jesus, one of the miners whispered, looking away from the mangled limb. Pete's gonna lose that leg for sure. Dr. Hartwell examined the injury with careful hands, but Kate could see uncertainty in his movements. The tremor made his assessment less thorough than it should have been, and she watched him struggle to determine the extent of the damage. Time was critical. Every minute of delay increased the risk of infection and reduced the chances of saving the limb. "Miss Sullivan, assist me with the examination," Dr. Hartwell said, stepping back slightly. Kate moved forward, grateful for the opportunity to get a closer look at the injury. Her fingers traced the fracture line with the precise touch she'd learned in surgery rotations, identifying the exact breakpoints and assessing nerve and blood vessel damage. "Doctor," she said carefully, "I believe I can feel a pulse in the dorsalis pedis artery. The foot is still receiving some circulation." She was giving him information that his own examination had missed, but framing it as if she were simply more sensitive to subtle signs. Dr. Hartwell's face brightened with hope. "You're right. I was concerned we'd lost the blood supply entirely." He began to outline a treatment plan, but Kate could see he was struggling with the complexity of the injury. The surgery required delicate work that is deteriorating fine. Motor control might not allow. "Doctor," Kate said quietly, positioning herself so the miners couldn't overhear, "would you like me to prepare the patient while you review the surgical approach? Sometimes it helps to visualize the procedure before beginning." It was a diplomatic way of giving him time to consult his medical texts, but more importantly, it would allow Kate to assess the injury more thoroughly. Dr. Hartwell nodded gratefully and stepped away to review his surgical manuals. Working alone with the unconscious miner, Kate conducted the kind of comprehensive examination she'd been trained to perform at Johns Hopkins. She carefully palpated the break sites, tested nerve responses, and evaluated tissue viability with the systematic thoroughness that had made her one of the top students in her class. The injury was severe but not hopeless if the surgery was performed correctly. When Dr. Hartwell returned, Kate was ready with a detailed assessment disguised as nursing observations. "Doctor, the patient's responses suggest the peroneal nerve is intact, though there may be some damage to the tibial nerve. The bone fragments appear to be contained within the soft tissue envelope." Dr. Hartwell stared at her with surprise. "Miss Sullivan, that's remarkably detailed observation for a nursing assessment." Kate felt her heart race. Had she revealed, too much medical knowledge? "I worked with several surgeons back east, doctor. I learned to notice details that might be helpful for planning procedures." The lie came easily, but she realized she needed to be more careful about displaying her expertise. The surgery took 3 hours, with Kate officially assisting but actually guiding much of the procedure through subtle suggestions and precisely timed instrument placement. When Dr. Hartwell's hands shook too much to place delicate sutures, Kate steadied them under the pretense of providing support. When he hesitated over anatomical landmarks, she positioned retractors to highlight the padu structures he needed to identify. "Hand me the bone forceps," Dr. Hartwell would say, and Kate would anticipate which size he needed based on the bone fragments visible in the wound. "I need better visualization of the nerve," he'd mutter, and Kate would adjust the lighting and retraction to provide perfect exposure. By the end of the procedure, they had successfully stabilized the fracture and restored blood flow to the foot. Peter Mackenzie would keep his leg, though he'd walk with a permanent limp. As they sutured the final layers of tissue, Dr. Hartwell looked at Kate with newfound respect. "Miss Sullivan, your surgical assistance was exceptional. Where exactly did you train?" Kate felt the dangerous moment approaching, the point where too many questions might expose her deception. "Various hospitals in Boston, doctor. I found that surgeons appreciated nurses who could anticipate their needs." She focused intently on cleaning instruments, avoiding direct eye contact that might reveal her nervousness. Well, their training methods were superior to anything I've seen. You have an intuitive understanding of surgical anatomy that's quite remarkable. The compliment was both thrilling and terrifying. Kate was proud of her surgical skills, earned through years of intensive study and practice. But every display of competence brought her closer to discovery. She needed to find ways to help her patients while maintaining the illusion that she was simply an exceptionally well-trained nurse. That evening, as Peter Mackenzie recovered under the influence of morphine, word of the successful surgery spread through Milbrook faster than wildfire. Kate was cleaning instruments when Margaret Henderson arrived with a basket of food and barely contained excitement. "Miss Sullivan, the whole town's talking about how you and Doc Hartwell saved Pete's leg. The miners were certain he'd lose it, but Tom Bradley says you two worked like you'd been partners for years." Kate accepted the food gratefully, realizing she'd been too focused on the surgery to think about eating. "Dr. Hartwell is an excellent surgeon. I was simply following his instructions. Tom said you seemed to know exactly what Doc needed before he asked for it. Said he'd never seen such smooth teamwork in a surgical procedure." Margaret's eyes sparkled with curiosity. "You must have had remarkable training back east." The conversation continued for another 20 minutes, with Margaret probing gently for details about Kate's background and experience. Kate fielded the questions carefully, providing just enough information to satisfy curiosity without revealing anything that could expose her true qualifications. After Margaret left, Kate sat alone in her small room, reflecting on the day's events. The surgery had been successful, but it had also demonstrated the precarious nature of her situation. Dr. Hartwell's condition was clearly worsening, and she was being called upon to fill gaps in his capabilities that went far beyond normal nursing duties. More concerning was the attention her skills were attracting. In a small town like Milbrook, word traveled fast, and people were already talking about the new nurse who seemed remarkably gifted in surgical assistance. Kate realized she would need to be more careful about displaying her medical knowledge, even when patient care might suffer as a result. The next few days brought a steady stream of patients with routine ailments: a child with a persistent cough, an elderly woman with arthritis, a miner with an infected wound from a week-old accident. Kate found herself walking a careful line between providing competent care and revealing too much expertise, when 8-year-old Sally Morrison arrived with what her mother described as just a cold that won't go away. Kate's examination revealed the characteristic whooping sound of pertussis. Dr. Hartwell had diagnosed it as a simple respiratory infection and prescribed basic cough medication. But Kate knew the child needed isolation and specific treatment to prevent the disease from spreading through the community. "Doctor," Kate said carefully, "I noticed the child's cough has a distinctive quality. Might it be worth considering additional precautions?" Dr. Hartwell examined Sally again, this time listening more carefully to the respiratory sounds Kate had identified. "You're absolutely right, Miss Sullivan. This is whooping cough, not a simple cold. We'll need to isolate the child and check other family members." The incident was handled quietly, but Kate realized she had likely prevented an epidemic that could have devastated Milbrook's children. The irony wasn't lost on her that she was saving lives while hiding the qualifications that made such diagnoses possible. As her second week in Milbrook drew to a close, Kate found herself settling into a routine that balanced medical competence with professional deception. She was learning to phrase her observations as nursing intuitions rather than medical diagnoses, to suggest treatments as questions rather than recommendations, and to guide Dr. Hartwell's decisions without appearing to supersede his authority. But she was also becoming increasingly aware of how much the community needed her real skills. Dr. Hartwell's condition was deteriorating faster than she'd initially realized, and Milbrook was facing medical challenges that required expertise he could no longer consistently provide. Kate found herself wondering how long she could maintain her deception, And what would happen to her patients when the inevitable crisis forced her to choose between hiding her qualifications and saving lives? The answer would come sooner than she expected, in the form of an epidemic that would test not only her medical skills, but her courage to finally reveal the truth about who she really was. 3 weeks into her tenure in Milbrook, Kate faced her first real threat of exposure, and it came from the most unexpected source: Father Miguel Santos, the town's Catholic priest who also served as the unofficial record keeper for births, deaths, and everything significant that happened in the mountain community. Father Santos was a man in his 50s with intelligent dark eyes and the lean build of someone who'd spent years walking between scattered mining camps to minister to his flock. Unlike many frontier priests, he was highly educated, having studied not only theology but also medicine at a seminary in Mexico City before coming north to serve the growing Hispanic population in Colorado's mining regions. Kate first encountered him on a Tuesday morning when he arrived at the clinic carrying Maria Gonzalez, a young woman from the Mexican quarter of town who was hemorrhaging badly after what appeared to be a miscarriage. Dr. Hartwell was visiting a mining camp 20 miles away, leaving Kate alone to handle the emergency. "Senorita Sullivan," Father Santos said in accented but precise English, "Maria needs immediate medical attention. She has lost much blood." Kate quickly assessed the situation with the clinical efficiency that had become second nature. The young woman was pale, her pulse rapid and weak, and the bleeding suggested incomplete expulsion of fetal tissue. This was a medical emergency that required surgical intervention, not nursing care. "Father Santos, we need to get her onto the examination table immediately," Kate said, abandoning her usual deference. "How long has she been bleeding like this?" "Since early morning. Her husband came to the church afraid to bring her here because—" Father Santos hesitated, his expression troubled. Kate understood immediately. Mexican families in Milbrook often avoided the clinic due to language barriers and cultural suspicions about Anglo medical care. By the time they sought help, conditions that could have been easily treated had often become life-threatening. Because they were afraid she wouldn't be treated properly, Kate finished. "Father, I need you to translate for me. Maria's condition is serious, but I can help her." As Kate examined the patient, Father Santos watched her every movement with the careful attention of someone trained to observe human behavior. She palpated Maria's abdomen with skilled hands, checked for signs of infection, and assessed the source and severity of the bleeding with the systematic thoroughness of a physician, not a nurse. "Miss Sullivan," Father Santos said quietly, "your examination is very comprehensive. You seem to know exactly what to look for." Kate felt the familiar flutter of panic, but Maria's condition demanded immediate attention. "I've assisted with many gynecological cases, Father. Time is critical here." She began preparing for a procedure that would remove the remaining tissue and stop the bleeding, a surgical intervention that was technically beyond a nurse's scope of practice. "Should we wait for Dr. Hartwell to return?" Father Santos asked, though his tone suggested he understood the urgency of the situation. "Maria doesn't have time to wait," Kate replied, already laying out surgical instruments. "I can perform this procedure under your supervision. Will you assist me?" The question was carefully phrased to suggest that Father Santos would be taking responsibility for authorizing the treatment, though Kate knew she was essentially performing unsupervised surgery. Father Santos studied her face for a long moment, then nodded. "What do you need me to do?" The procedure took 45 minutes, with Kate working with the precise confidence of someone who had performed similar operations dozens of times. Father Santos assisted by translating her explanations to Maria and helping to keep the young woman calm during the most difficult moments. But Kate was acutely aware that he was also studying her technique with the educated eye of someone who understood medical procedures. When the surgery was complete and Maria was resting comfortably, Father Santos helped Kate clean the instruments in thoughtful silence, Finally, he spoke. "Miss Sullivan, I studied medicine for 2 years before I felt called to the priesthood. What you just performed was not nursing, it was skilled surgical care that saved that young woman's life." Kate felt her heart race as she faced the moment she'd been dreading. "Father, please let me finish." Father Santos dried his hands carefully before continuing. "I watched you work today, and I saw someone with extensive surgical training. Your knowledge of anatomy, your instrument handling, your decision-making process, these are not skills that nurses typically possess." Kate stood frozen, unsure whether to continue her deception or confess the truth to this perceptive man who could destroy her entire charade with a few words to the right people. "I also saw," Father Santos continued, "someone who risked her own safety to save the life of a young Mexican woman that many in this town would have considered expendable. Whatever your secrets, Miss Sullivan, your heart is in the right place." The priest moved closer, lowering his voice. "I will not betray your confidence, but I would like to understand why someone with your obvious medical training is working as a nurse in a frontier town." Kate found herself telling Father Santos the truth, not all of it, but more than she'd shared with anyone since arriving in Milbrook. She described the barriers facing women in medicine, the hospitals that refused to hire female physicians, the patients who wouldn't accept treatment from a woman doctor. "So you came west hoping to practice medicine, even if you had to pretend to be a nurse," Father Santos said when she finished. "It is a dangerous deception, but I understand the desperation that drove you to it. Will you tell anyone?" Kate asked, her voice barely above a whisper. Father Santos smiled with genuine warmth. "The seal of confession extends beyond the confessional booth, Miss Sullivan. Your secret is safe with me, but I hope someday you will find the courage to practice medicine openly. This community needs physicians who care about all of our people, not just the wealthy Anglo families." Their conversation was interrupted by Dr. Hartwell's return from the mining camp. Kate quickly briefed him on Maria's treatment, describing it as emergency care that couldn't wait for his return. Dr. Hartwell examined the patient and pronounced the surgery expertly performed, though he seemed puzzled by the level of skill displayed. "Miss Sullivan, this type of procedure requires considerable expertise. Are you certain you were only assisting when you observed similar cases back east?" "Dr. Hartwell, emergencies sometimes require us to exceed our normal limitations," Kate replied diplomatically. "I followed the procedures I'd seen performed and trusted in Providence to guide my hands." It was a carefully crafted response that acknowledged her skill while attributing it to divine intervention rather than medical training. But Kate could see that Dr. Hartwell remained puzzled by her capabilities. Over the following days, Kate found herself with an unexpected ally in Father Santos. The priest began referring medical cases from the Mexican community, families who had previously avoided the clinic due to cultural barriers and language difficulties. He also served as an unofficial character witness, his approval helping to establish Kate's reputation among townspeople, who might otherwise have been suspicious of a single woman with mysterious qualifications. But Father Santos' support came with its own complications. His referrals included several cases that required Kate to display medical knowledge that went far beyond nursing education. When he brought in a child with what appeared to be appendicitis, Kate had to carefully guide Dr. Hartwell toward the correct diagnosis while pretending to be making nursing observations rather than medical assessments. "The child's pain seems to be localizing in the right lower quadrant, doctor," Kate observed during the examination, "and he appears to be guarding against abdominal pressure." Dr. Hartwell palpated the boy's abdomen, his tremor making the examination less precise than it should have been. "Yes, I see what you mean. The presentation is consistent with ... He paused, confusion flickering across his face as if he couldn't remember the diagnosis. "Appendicitis, doctor?" Kate suggested gently. "Of course, appendicitis. Thank you, Miss Sullivan." Dr. Hartwell's relief at her prompting was becoming more frequent and more obvious. Kate realized that she was increasingly becoming the medical decision-maker in their partnership, though she had to disguise her leadership as nursing support. Appendectomy that followed became another test of Kate's ability to guide complex surgery while maintaining her deceptive role. She positioned instruments before Dr. Hartwell asked for them, anticipated complications he hadn't yet recognized, and subtly corrected his technique when his tremor threatened the precision required for abdominal surgery. "Miss Sullivan, Doctor," Hartwell said as they completed the procedure, "your surgical intuition is remarkable. You seem to anticipate every need." "I've learned to read the surgeon's intentions, Doctor," Kate replied. "It helps when we work as a team." But their success was attracting attention from unexpected quarters. Mayor John Patterson, a heavyset man who owned the town's largest general store, arrived at the clinic the day after the appendectomy with questions that made Kate's stomach clench with anxiety. "Doc Hartwell, folks are talking about your new nurse," Mayor Patterson said, settling his bulk into one of the waiting room chairs. "They say she's got skills that seem mighty advanced for someone who's supposed to be following orders." Dr. Hartwell straightened defensively. "Miss Sullivan is an exceptionally well-trained nurse, Mayor. Her assistance has been invaluable." "I'm sure it has. But Tom Bradley was telling me she seemed to know as much about that mining accident surgery as you did. And now word is she practically performed that appendectomy herself while you supervised." Kate felt her pulse racing as she listened from the examination room, pretending to organize supplies while actually straining to hear every word of the conversation that could determine her fate. "Mayor Patterson," Dr. Hartwell said with growing irritation, "are you questioning my medical judgment?" "Not at all, Doc. Just wondering if maybe we ought to know more about Miss Sullivan's background. Where exactly did she train? What hospitals did she work at? Seems like important information for the town council to have." The threat was clear. Mayor Patterson was considering an investigation into Kate's credentials that would almost certainly expose her deception. Kate realized she needed to take action before suspicions hardened into formal inquiries that would reveal the truth about her forged nursing certificate and fictional work history. That evening, Kate sought out Father Santos at the small adobe church that served Milbrook's Mexican community. She found him preparing for evening mass, lighting candles before a simple wooden crucifix that reminded her how far she was from the sophisticated world of Boston medicine. "Father, I need your advice," Kate said without preamble. "Mayor Patterson is asking questions about my background. I think he suspects something." Father Santos finished lighting the candles before turning to face her. "What kind of questions?" Kate described the conversation she'd overheard, watching Father Santos' expression grow more serious as she explained the mayor's implied threats. "Miss Sullivan," Father Santos said finally, "you have helped more people in 3 weeks than some physicians help in 3 years. But you are walking a dangerous path. How long can you maintain this deception?" "I don't know," Kate admitted. "But what choice do I have? If the truth comes out, I'll be run out of town, and Dr. Hartwell can't handle the medical needs of this community alone." Father Santos was quiet for several minutes, clearly wrestling with the moral complexities of Kate's situation. Finally, he spoke. "There may be a way to protect you, but it would require trust and careful timing. I serve not only Milbrook but 7 mining camps in these mountains. The miners and their families have come to respect my judgment about medical matters. If I were to speak strongly in your favor, you would risk your own reputation to protect mine," Kate finished. "Sometimes protecting the greater good requires accepting personal risk," Father Santos replied. "But Miss Sullivan, you must promise me something in return." "What?" "Promise me that when the time comes, and it will come, you will have the courage to reveal the truth. This community deserves to know that they have been blessed with a physician of extraordinary skill, even if she happens to be a woman." Kate looked around the simple church, thinking about the lives she'd already saved and the lives she might save in the future if she could continue practicing medicine in Milbrook. Father Santos was offering her protection, but he was also asking her to prepare for the day when hiding would no longer be possible. "I promise," Kate said, though she had no idea how or when she would find the courage to keep that promise. She couldn't know that within 3 months, a diphtheria epidemic would sweep through the mining camps, creating exactly the crisis that would force her to choose between maintaining her deception and saving dozens of lives. When that moment came, Father Santos' support would prove crucial, but Kate's survival would ultimately depend on her own courage to finally practice medicine as the physician she'd always been meant to be. The crisis that would test both Kate's medical skills and her ability to maintain her deception came not from the mines or the Mexican quarter, but from the most respectable family in Milbrook. Elizabeth Patterson, the mayor's 15-year-old daughter and the town's acknowledged beauty, collapsed during Sunday morning services at the Methodist Church with symptoms that sent panic rippling through the congregation. Kate was attending the same service, sitting quietly in the back pew as she'd done for the past month, when young Elizabeth suddenly stood up during the hymn singing, swayed visibly, and crumpled to the floor in convulsions. The girl's body went rigid, her back arching unnaturally, while her jaw clenched so tightly that worried murmurs of lockjaw began spreading through the terrified congregation. Reverend Thomas Whitmore, an elderly man better suited to spiritual counsel than medical emergencies, called out desperately, "Is Dr. Hartwell here? Someone fetch Dr. Hartwell." But Dr. Hartwell was 20 miles away, treating an outbreak of dysentery at the Copper Creek mining camp, and wouldn't return until late evening. Kate realized that she was the only person present with the medical knowledge to help Elizabeth Patterson, but intervening would mean revealing expertise that no nurse should possess. As Kate hesitated, torn between her desire to help and her need to protect her secret, Elizabeth's convulsions worsened. Foam appeared at the corners of her mouth, and her breathing became labored and irregular. Kate recognized the signs immediately: acute strychnine poisoning, probably from contaminated medicine or accidentally ingested rat poison. Mayor Patterson knelt beside his daughter, his face pale with terror. "Somebody do something, she's dying." The crowd pressed closer, but no one knew what to do. Kate watched Elizabeth's condition deteriorate and realized that medical protocol demanded immediate action. The girl would die without proper treatment, and Kate was the only person who could provide it, making a decision that would change everything. Kate pushed through the crowd and knelt beside Elizabeth. "Everyone step back and give her air," she commanded with an authority that startled the congregation. "Mayor Patterson, I need you to help me get her to the clinic immediately." "Miss Sullivan," Reverend Whitmore protested, "shouldn't we wait for Dr. Hartwell?" "There's no time," Kate replied, already beginning to treat Elizabeth with the confidence of someone who had handled similar emergencies. "This is poisoning, and every minute we delay reduces her chances of survival." Kate's decisive action galvanized the crowd. Mayor Patterson and 3 other men carefully lifted Elizabeth while Kate supported her head and monitored her breathing. As they carried the convulsing girl toward the clinic, Kate found herself naturally taking charge of the emergency, issuing instructions with the clinical authority she'd been hiding for months. "Keep her head elevated, but watch for vomiting," Kate directed. "If she starts to vomit, turn her head to the side immediately to prevent aspiration." At the clinic, Kate worked with methodical efficiency to treat what she now confirmed was severe strychnine poisoning. She administered activated charcoal to absorb remaining toxins, used chloral hydrate to control the convulsions, and carefully monitored Elizabeth's vital signs, while providing supportive care that would help her body eliminate the poison. Throughout the 3-hour crisis, Mayor Patterson watched Kate work with growing amazement. Her treatment was systematic, confident, and obviously based on extensive medical knowledge. She explained each intervention in terms that demonstrated deep understanding of toxicology and emergency medicine. "Miss Sullivan," Mayor Patterson said, During a quiet moment while Elizabeth rested under sedation, "What you're doing, this isn't nursing. This is physician-level care." Kate felt the moment of truth approaching, the confrontation she'd been dreading since arriving in Milbrook. "Mayor Patterson, I'm doing what needs to be done to save your daughter's life, but how do you know to do it? Where did you learn to treat strychnine poisoning? How do you know which medications to use and at what dosages?" Before Kate could answer, Father Santos arrived at the clinic. He'd heard about the emergency and come to offer spiritual support, but he immediately grasped the significance of what was happening. Mayor Patterson, the man who had been questioning Kate's credentials, was witnessing firsthand the medical expertise she'd been trying to hide. "Father," Mayor Patterson said, turning to the priest with obvious confusion, "Miss Sullivan just saved my daughter's life, but she's treating her like she's a doctor, not a nurse." Father Santos studied Kate's face carefully, recognizing the moment he'd predicted, the crisis that would force her to choose between deception and healing. "Perhaps," he said diplomatically, "we should focus on the blessing that Miss Sullivan was present when Elizabeth needed help." But Mayor Patterson wasn't satisfied with diplomatic deflection. As Elizabeth's condition stabilized and the immediate crisis passed, he pressed for answers with the persistence of a man whose suspicions had been confirmed. "Miss Sullivan, I want the truth. What is your real background? Where exactly did you train? And why are you working as a nurse when you clearly have the skills of a physician?" Kate realized that her deception had reached its breaking point. Mayor Patterson had seen too much to be satisfied with vague explanations, and lying further would only make the eventual revelation more damaging. But admitting the truth meant risking everything she'd built in Milbrook. "Mayor Patterson," Kate said carefully, "I trained at Johns Hopkins University School of Medicine. I graduated with a medical degree 3 years ago, but no hospital in Boston would hire a female physician. I came west hoping to practice medicine, even if I had to do it as a nurse." The silence that followed her confession seemed to last forever. Mayor Patterson stared at her with an expression that mixed shock, anger, and grudging respect. Father Santos watched both of them carefully, ready to intervene if the conversation turned hostile. "You're telling me," Mayor Patterson said slowly, "that you've been practicing medicine in this town under false pretenses? That you've been deceiving Dr. Hartwell and everyone else about your qualifications?" "I've been saving lives," Kate replied, with quiet dignity. "Elizabeth is alive because I have medical training that goes beyond nursing. Peter Mackenzie kept his leg because I could guide complex orthopedic surgery. Maria Gonzalez survived her hemorrhage because I could perform emergency gynecological procedures." Mayor Patterson was quiet for several minutes, clearly struggling with the implications of Kate's revelation. His daughter was breathing peacefully under Kate's expert care, alive because of medical knowledge that had been obtained through deception. "Miss Sullivan," he said finally, "what you've done, the deception ... it's serious. But what you've accomplished ... he gestured toward Elizabeth. "My daughter would be dead if you hadn't been here today." Father Santos stepped forward, sensing an opportunity to shape the conversation's direction. "Mayor Patterson, perhaps the question isn't whether Miss Sullivan's credentials were obtained through deception, but whether this community has benefited from her presence. The question," Mayor Patterson corrected, "is what we do now. I can't ignore what I've learned, but I also can't ignore the fact that she saved my daughter's life." Kate prepared herself for the worst. Mayor Patterson had the authority to expose her deception to the entire town, to demand her arrest for practicing medicine without proper licensing, to destroy everything she'd built in Milbrook. Her future depended entirely on the judgment of a man she'd been deceiving for months. "Miss Sullivan," Mayor Patterson said after another long pause, "I need to think about this situation. In the meantime, my daughter needs continued care, and Dr. Hartwell isn't here. Will you continue treating her?" "Of course," Kate replied immediately. Elizabeth's recovery will require careful monitoring for the next 24 hours. Then that's what matters right now. Mayor Patterson stood up with obvious difficulty, the stress of the day etched on his face. We'll discuss the other issues later. After the mayor left, Father Santos helped Kate monitor Elizabeth through the evening. As they worked together, the priest offered insights that proved he'd been thinking carefully about Kate's situation. "Miss Sullivan," he said as they checked Elizabeth's vital signs, "today changed everything. Mayor Patterson can't unknow what he's learned, but he also can't ignore what you've accomplished. What do you think he'll do?" Kate asked, though she wasn't sure she wanted to hear the answer. "I think he's a practical man who loves his daughter. He's also a politician who understands that exposing you might deprive this community of medical care it desperately needs." Father Santos adjusted Elizabeth's blankets before continuing. "But he'll want assurances that your deception won't create legal problems for the town." Kate nodded, understanding the complexity of her situation. Mayor Patterson's silence would come with conditions, and she would have to accept whatever terms. He demanded to continue practicing in ILLBROK. When Dr. Hartwell returned late that evening, he found Elizabeth Patterson recovering under Kate's care and Mayor Patterson waiting to speak with him privately. Kate wasn't included in their conversation, but she could guess its general direction from the serious expressions on both men's faces. Dr. Hartwell emerged from the discussion looking troubled but not hostile. "Miss Sullivan," he said quietly, "Mayor Patterson has shared some concerning information about your background. We need to discuss this situation thoroughly, but not tonight. Elizabeth's recovery must be our priority." Kate spent the night at the clinic, monitoring Elizabeth's condition and reflecting on how dramatically her life had changed in a single day. Her secret was out, at least partially, and her future in Milbrook would depend on negotiations with men who now knew she'd been deceiving them for months. But as she watched Elizabeth Patterson sleep peacefully through the night, breathing steadily and showing clear signs of recovery, Kate felt a sense of professional satisfaction that made the uncertainty worthwhile. She had practiced medicine openly for the first time since leaving Boston, using her full range of skills to save a young woman's life. The next morning brought unexpected developments. Word of Elizabeth's near-death experience and Kate's life-saving intervention had spread through Milbrook faster than Kate had thought possible. But instead of the hostile reaction she'd feared, townspeople began arriving at the clinic to express their gratitude and support. Margaret Henderson came first, bringing breakfast and a story about how Kate had correctly diagnosed her nephew's condition weeks earlier. "I don't care what anyone says about credentials," Margaret declared firmly. "You saved that boy's life, and now you've saved Elizabeth Patterson. That's all the qualification I need." Tom Bradley arrived next with a group of miners from the Silver Strike claim. "Miss Sullivan," he said formally, "the boys and I heard what happened yesterday. We want you to know that as far as we're concerned, you're the best doctor this town's ever had, whatever your official title might be." The support continued throughout the morning, with families Kate had treated expressing their confidence in her abilities regardless of questions about her credentials. Even more surprising was the arrival of women from the Mexican Quarter, led by Maria Gonzalez, who had recovered completely from her emergency surgery. "Dr. O'Sullivan," Maria said in halting English, "you saved my life. You save Elizabeth's life. You are a good doctor, no matter what papers say." By noon, Kate realized that while her secret had been exposed to the town's leadership, the community itself was rallying to her defense. The people she'd treated during her months in Milbrook were more concerned with her medical competence than her credentials, and their support might prove crucial in determining her future. When Mayor Patterson returned that afternoon, he found the clinic surrounded by townspeople who had come to demonstrate their confidence in Kate's abilities. Their message was clear. Whatever questions existed about her background, the community wanted her to continue providing medical care. "Miss Sullivan," Mayor Patterson said after surveying the crowd outside. "It appears you have more support than I anticipated. Perhaps it's time we discussed how to resolve this situation in a way that serves everyone's interests." Kate realized that her crisis had become an opportunity, a chance to practice medicine openly, with community support, if she could navigate the political and legal challenges that lay ahead. The conversation with Mayor Patterson would determine whether she could finally stop hiding her medical training and begin practicing as the physician she'd always been meant to be. The meeting that would determine Kate's future in Milbrook took place 3 days after Elizabeth Patterson's recovery, in the back room of Henderson's General Store, where the town council conducted its official business. The cramped space, usually reserved for discussing road repairs and tax assessments, now hosted a debate that would challenge everything the frontier community thought it knew about medicine, gender roles, and legal authority. Mayor Patterson sat at the head of a scarred wooden table, flanked by the 4 other council members. Margaret Henderson, whose support for Kate had been unwavering. Samuel Morrison, the conservative bank president who viewed any deviation from established norms with deep suspicion. Dr. Marcus Hartwell, whose deteriorating condition made his participation both crucial and unpredictable. And surprisingly, Father Santos, who had been invited as a community representative despite not being an official council member. Kate entered the room wearing her best dress and navy blue ensemble she'd saved for important occasions, and carrying a leather portfolio containing her medical diploma, transcripts from Johns Hopkins, and letters of recommendation from professors who had believed in her abilities even when the medical establishment didn't. "Miss Sullivan," Mayor Patterson began formally, "this meeting is to address the irregularities in your credentials and determine how this community should proceed regarding your medical practice." Samuel Morrison leaned forward aggressively. "Irregularities? Mayor Patterson, let's call this what it is: fraud. Miss Sullivan has been practicing medicine illegally, deceiving this community about her qualifications, and placing all of us at legal risk." Kate felt her heart racing, but she forced herself to respond calmly. "Mr. Morrison, I have never claimed to be anything other than trained medical personnel. I have medical credentials that exceed those required for the care I've been providing." "Under false pretenses," Morrison's voice rose with indignation. "You presented yourself as a nurse when you're actually an unlicensed physician. Do you understand the legal implications of practicing medicine without proper state certification?" Dr. Hartwell, who had been unusually quiet, finally spoke up. "Samuel, perhaps we should focus on results rather than technicalities. In the months Miss Sullivan has been here, our medical outcomes have improved dramatically. Complications have decreased, patient satisfaction has increased, and we've successfully handled several cases that might have resulted in deaths or permanent disabilities." Morrison turned his glare on Dr. Hartwell. "Marcus, are you seriously suggesting we ignore the law because this woman happens to be competent?" "I'm suggesting," Dr. Hartwell replied with more strength than Kate had seen from him in weeks, "that competence matters more than paperwork when people's lives are at stake." Margaret Henderson nodded emphatically. "Dr. Hartwell is right. My nephew is alive today because Miss Sullivan recognized his condition when others missed it. Elizabeth Patterson is alive because Miss Sullivan had the knowledge and courage to act when it mattered most." Father Santos, who had been listening carefully to the exchange, raised his hand for attention. "If I may offer a perspective from outside your immediate political concerns," he said diplomatically, "the question before you isn't whether Miss Sullivan violated bureaucratic procedures. The question is whether this community is better served with her medical expertise or without it." Morrison wasn't swayed by appeals to practical considerations. "Father Santos, what you're advocating is vigilante medicine. If we allow unlicensed practitioners to operate freely, where does it end? What's to stop any charlatan from claiming medical expertise?" Kate realized she needed to address Morrison's concerns directly if she had any hope of winning the council's approval. "Mr. Morrison, may I show you my credentials?" She opened her portfolio and placed her Johns Hopkins diploma on the table, followed by her academic transcripts and letters of recommendation. "These documents prove that I received the same medical education as any licensed physician. The only difference is that no state medical board will grant licenses to women, regardless of their qualifications." Morrison examined the documents skeptically. "Impressive papers, but they don't change the fact that you're practicing outside the legal framework that governs medical care in Colorado." "What legal framework?" Margaret Henderson interjected. "Samuel, this is frontier territory. Half the towns in Colorado don't have licensed physicians. We make do with whatever medical care we can find, and we're grateful to get it." Mayor Patterson, who had been letting the debate unfold, finally stepped in to regain control. "The legal questions are serious, but they're not the only considerations. Miss Sullivan, if we were to regularize your situation, what would you propose?" Kate had been preparing for this moment since her confrontation with Mayor Patterson 3 days earlier. "I propose to continue providing medical care under Dr. Hartwell's supervision, with full transparency about my qualifications. Patients would know they're receiving care from someone with medical training equivalent to a physician's, even if my official title remains nurse." Dr. Hartwell leaned forward with interest. "Miss Sullivan, would you be willing to formalize that arrangement? To work as my associate, sharing responsibility for patient care while I handle the legal and administrative aspects." Kate felt a surge of hope at Dr. Hartwell's proposal. Working as his associate would allow her to practice medicine openly while providing legal cover through his established credentials. "Dr. Hartwell, I would be honored to work with you in that capacity." Morrison remained skeptical. "Marcus, you're proposing to stake your reputation and license on someone who's already demonstrated a willingness to deceive authorities. What happens when the state medical board investigates?" It was Father Santos who provided the answer that would prove crucial. "Mr. Morrison, I've been corresponding with colleagues in Denver and Santa Fe about medical practice in frontier territories. The state medical board's jurisdiction is flexible in communities that lack access to licensed physicians. As long as patient care meets acceptable standards and local authorities approve the arrangement, they rarely intervene." Mayor Patterson nodded slowly. "Father Santos raises an important point. We're not talking about establishing a precedent for populated areas with established medical communities. We're talking about a remote mining town that struggled to attract any medical care at all." The debate continued for another hour, with Morrison raising increasingly technical objections while the other council members gradually moved toward accepting Kate's proposal. The turning point came when Dr. Hartwell made a confession that shocked everyone present. "Before we continue," Dr. Hartwell said quietly, "there's something you all need to know about my own situation." He paused, gathering courage for a revelation that Kate realized would be as difficult for him as hers had been. "I've been diagnosed with progressive neurological deterioration. My condition will continue to worsen, and within a year or two, I won't be able to practice medicine effectively." The room fell silent as the implications of Dr. Hartwell's announcement sank in. Kate felt a mixture of sympathy for his situation and understanding of why he'd been so supportive of her irregular status. "Marcus," Mayor Patterson said gently, "how long have you known?" 6 months. I consulted specialists in Denver, hoping for treatment options, but the prognosis is clear. Miss Sullivan's arrival has been a blessing, not just for the community, but for me personally. She's allowed me to continue serving our patients while preparing for the transition that's inevitable." Morrison's hostility deflated somewhat in the face of Dr. Hartwell's personal tragedy. "Marcus, I'm sorry. I had no idea you were dealing with such serious health issues." "Which brings us back to the central question," Margaret Henderson said firmly. Do we want to maintain medical care for this community, or do we let bureaucratic concerns override practical needs? Mayor Patterson called for a formal vote. All in favor of accepting Miss Sullivan as Dr. Hartwell's medical associate, with full community knowledge of her qualifications and status? Margaret Henderson, Dr. Hartwell, and Father Santos raised their hands immediately. Mayor Patterson hesitated for a moment, then raised his hand as well. Motion carries 4-1. Morrison shook his head in disapproval but didn't challenge. The outcome. I hope you all understand the risks you're taking. When this arrangement comes to the attention of territorial authorities, don't expect me to defend decisions I opposed. Kate felt overwhelming relief at the council's decision, but she also understood that her troubles were far from over. Morrison's warning about territorial authorities was legitimate word of a woman practicing medicine, even with local approval, would eventually reach officials who might take a very different view of the arrangement. After the meeting, Dr. Hartwell approached Kate with a proposal that would formalize their partnership. Miss Sullivan, I'd like to make you my official medical partner, with shared responsibility for all patient care. Your name will appear on our practice sign, and patients will know they're receiving care from a qualified physician, regardless of gender. Kate accepted the offer with gratitude, but she was also aware that increased visibility would bring increased scrutiny. Making her role public would attract attention from beyond Milbrook, potentially including hostile reactions from medical establishment figures who opposed women in medicine. Her concerns proved justified when, 2 weeks later, a stranger arrived in town asking pointed questions about the medical practice. James Crawford was a territorial health inspector, a thin man with pale eyes and the officious manner of someone who enjoyed wielding bureaucratic authority. Crawford's investigation began with a visit to the clinic, where he found Kate treating a mining accident victim while Dr. Hartwell was attending to patients in the adjacent examination room. The inspector watched Kate work for several minutes before introducing himself. Miss Sullivan, I'm James Crawford from the Territorial Health Department. I'm here to investigate reports of irregular medical practice in Milbrook. Kate felt her stomach drop, but she continued cleaning the miner's wounds with steady hands. Mr. Crawford, all medical care in this community is provided under Dr. Hartwell's supervision and with local authority approval. Crawford consulted a notebook filled with handwritten notes. My information suggests you've been practicing medicine independently, making diagnoses and performing procedures that exceed nursing authority. Your information is incorrect, Kate replied calmly. I work as Dr. Hartwell's medical associate, handling cases within my demonstrated competence. Miss Sullivan, territorial law doesn't recognize the position of medical associate for unlicensed practitioners. You're either a licensed physician or you're not. Since you're not licensed in Colorado, any independent medical practice is illegal. Dr. Hartwell, who had finished with his patient, joined the conversation. Mr. Crawford, Miss Sullivan works under my direct supervision. I take full responsibility for all medical decisions and treatments. Crawford turned his attention to Dr. Hartwell with obvious skepticism. Doctor, my investigation suggests Miss Sullivan has been making independent medical decisions, performing surgery without your direct oversight, and essentially functioning as an unlicensed physician. Kate realized that someone had been providing Crawford with detailed information about her activities, information that could only have come from someone who had been observing the clinic carefully. Her suspicion fell immediately on Samuel Morrison, whose opposition to her arrangement had been both vocal and persistent. Mr. Crawford, Dr. Hartwell said with growing irritation, are you questioning my professional judgment about how to manage my own practice? I'm investigating violations of territorial health regulations, Crawford replied stiffly. If Miss Sullivan has been practicing medicine without proper licensing, regardless of local approval, she's subject to prosecution under territorial law. The confrontation escalated when Crawford demanded to examine all patient records and treatment. Documentation. Kate and Dr. Hartwell found themselves defending every medical decision they'd made. With Crawford scrutinizing their work for evidence of illegal practice, the investigation continued for 3 days, with Crawford interviewing patients, reviewing medical records, and gathering testimony from townspeople about Kate's role in their medical care. Kate realized that her future and possibly her freedom depended on how Crawford interpreted the evidence he was collecting. On the final day of his investigation, Crawford announced that he would be filing a report recommending that territorial authorities take action against both Kate and Dr. Hartwell for violations of medical practice regulations. The threat was clear. Kate faced possible arrest and prosecution, while Dr. Hartwell risked losing his license for supervising unlicensed practice. As Crawford prepared to leave Milbrook, Kate understood that her battle for acceptance was far from over. Local support had protected her from immediate threats, but territorial authorities operated under different rules and priorities. The epidemic that would soon test her medical skills to their absolute limits would also determine whether she could survive the legal and political challenges that threatened to destroy everything she'd built in the frontier community that had become her home. October brought the first hard frost to the Colorado mountains, and with it came news that would test every skill Kate had acquired during her months in Milbrook. The warning arrived in the form of Jake Williams, a grizzled prospector who rode his exhausted horse down from the remote Copper Creek mining camp with desperation etched on his weathered face. Kate was organizing medical supplies in the clinic's storage room when she heard the commotion outside. Through the window, she saw Jake dismounting unsteadily, his clothes dusty from a hard ride, his expression carrying the kind of urgency that meant trouble was coming fast. "Doc Hartwell, Miss Sullivan," Jake called out as he stumbled toward the clinic door. "You gotta come quick. We got sickness up at Copper Creek like nothing I ever seen before." Dr. Hartwell emerged from his office, moving more slowly than usual, his condition having worsened noticeably since the territorial inspector's visit 2 weeks earlier. "Jake, what kind of sickness? How many people are affected?" Jake's response sent a chill through Kate's medical training. "Started with the Morrison children 3 days ago. High fever, terrible sore throat, gray patches in their mouths. Now it's spread to half the camp. Kids are choking to death, Doc. We've lost 2 already, and there's more that ain't gonna make it through the night without help." Kate felt her pulse quicken as she recognized the symptoms Jake described. The gray patches in the throat, the choking, the rapid spread through a community. This was diphtheria, one of the most feared childhood diseases of the era. Without proper medical intervention, the mortality rate could reach 50% or higher. "Dr. Hartwell," Kate said quietly, "we need to discuss this situation privately before we respond." Dr. Hartwell nodded, understanding her concern. "Jake, give us a few minutes to gather medical supplies. Help yourself to coffee from the kitchen." In the privacy of Dr. Hartwell's office, Kate shared her assessment. "Doctor, based on Jake's description, I believe we're dealing with diphtheria. The gray membrane formation, the respiratory distress, the rapid community spread, all consistent with epidemic diphtheria." Dr. Hartwell's face paled as he grasped the implications. "Diphtheria. I've read about it, but I've never treated a case. The mortality rates are devastating, especially in isolated communities without proper medical support." Kate realized she was facing a moment that would define not only her medical career, but potentially the survival of an entire mining camp. "Dr. Hartwell, I treated diphtheria cases during my clinical rotations at Johns Hopkins. There are specific protocols, antitoxin administration, airway management, isolation procedures that can significantly reduce mortality if implemented quickly." "Miss Sullivan," Dr. Hartwell said with obvious relief, "your expertise may be the only thing standing between Copper Creek and a catastrophic outbreak, but you understand the risks? If we can't control this epidemic, the territorial authorities will blame our irregular medical arrangement. Kate understood the implications perfectly. Success would validate her medical competence and potentially secure her position in Milbrook permanently. Failure would likely result in devastating loss of life and the end of her medical career, possibly including criminal prosecution for practicing without proper licensing. "Dr. Hartwell," Kate said with growing conviction, "we can't let bureaucratic concerns override medical necessity. People are dying, and we have the knowledge to help them." Within an hour, Kate and Dr. Hartwell were loaded into Tom Bradley's wagon with enough medical supplies to establish a field hospital. Kate had insisted on bringing antitoxin serum, tracheotomy equipment, and isolation materials preparations that would prove crucial in the days ahead. The ride to Copper Creek took 3 hours through mountain terrain that grew increasingly rough as they climbed toward the mining camp. Kate used the travel time to brief Dr. Hartwell on diphtheria management protocols, explaining the disease's progression and the interventions that could save lives. "The key is early identification and immediate isolation," Kate explained as their wagon bounced over rocky trails. "Diphtheria spreads through respiratory droplets, so we need to prevent contact between infected and healthy individuals. The antitoxin is most effective in the early stages, but even advanced cases can respond if we can maintain their breathing." Dr. Hartwell listened intently, clearly relying on Kate's expertise to guide their response. "Miss Sullivan, I'm going. To be honest with you, my condition has progressed to the point where fine motor control is becoming difficult. You'll need to handle the more delicate procedures." Kate felt the weight of responsibility settling on her shoulders. She would be leading a medical response that could affect dozens of lives, working without the safety net of hospital support or specialist consultation. Her Johns Hopkins training would be tested under conditions that would challenge even experienced physicians. Copper Creek was a rough mining camp of perhaps 60 residents, mostly men working silver claims scattered throughout the surrounding hills. The camp consisted of a dozen wooden buildings clustered around a central area that served as both supply depot and social center. What struck Kate immediately was the eerie quiet that had replaced the usual bustle of mining activity. Camp Supervisor Bill McKenzie, Jake Williams' younger brother, met them at the edge of the settlement. His face carried the haggard expression of someone who'd been watching people die without knowing how to help them. "Doc Hartwell, Miss Sullivan. Thank God you're here. We got 18 people showing symptoms now, most of them kids. The Morrison family lost both their young ones yesterday, and the Patterson children." He gestured helplessly toward a small cabin where sounds of distressed breathing could be heard. Kate immediately took charge of the medical response, her Johns Hopkins training kicking in automatically. "Mr. McKenzie, we need to establish isolation areas immediately. Anyone showing symptoms must be separated from healthy individuals. We'll also need a clean space for medical procedures and supplies." As they began organizing the camp's response, Kate conducted rapid assessments of the affected patients. What she found confirmed her worst fears. The epidemic was well established, with cases ranging from early-stage throat inflammation to advanced respiratory obstruction that threatened immediate death. In the Patterson cabin, she found 2 children, 8-year-old Sarah and 6-year-old Timothy, struggling to breathe through airways partially blocked by the characteristic gray membranes of diphtheria. Their parents watched helplessly as Kate examined the children with systematic thoroughness. "Mrs. Patterson," Kate said gently, "your children have diphtheria, but we can help them. The next 24 hours will be critical, but with proper treatment, most children recover completely." Kate began administering antitoxin serum to both children, calculating dosages based on their weight and disease severity. She also started them on supportive care, fever reduction, fluid management, and careful monitoring of their breathing while explaining each intervention to Dr. Hartwell and the anxious parents. The real crisis came that evening when young Timothy Patterson's breathing became so labored that Kate realized his airway was closing completely. Without immediate intervention, the child would suffocate within minutes. "Dr. Hartwell," Kate said urgently, "Timothy needs an emergency tracheotomy. His airway is obstructed beyond what medical management can handle." Dr. Hartwell's hands were shaking too badly to perform the delicate surgery required. "Miss Sullivan, I can't. My condition won't allow me to do this procedure safely." Kate found herself facing the moment she'd been preparing for since arriving. In Milbrook, she could perform the tracheotomy. She'd done them during her surgical rotations, but doing so would mean practicing medicine openly, without any pretense of working under supervision. "Dr. Hartwell," Kate said quietly, "will you authorize me to perform this procedure?" "Miss Sullivan," Dr. Hartwell replied with obvious relief, "you have my full authorization to do whatever is necessary to save this child's life." Working by lamplight in the rustic cabin, Kate performed her first independent surgical procedure since graduating from Johns Hopkins. She made a precise incision in Timothy's throat, carefully dissected through the tissue layers, and inserted a breathing tube that immediately restored his ability to get air into his lungs. The successful surgery marked a turning point in both the epidemic response and Kate's role in the community. Word spread quickly through the mining camp that the woman doctor, for that's how people began referring to her, had saved Timothy Patterson's life through skilled surgery that no one else could have performed. Over the following 3 days, Kate worked around the clock to treat diphtheria patients while implementing public health measures to control the outbreak's spread. She administered antitoxin to 18 patients, performed 2 additional tracheotomies, and established isolation protocols that prevented the disease from spreading to unaffected families. Dr. Hartwell assisted as he was able, but his deteriorating condition made Kate the de facto leader of the medical response. She found herself making life and death decisions, directing nursing care, and coordinating with camp leadership to implement disease control measures. The breakthrough came on the 4th day when the first patients began showing clear signs of recovery. Sarah Patterson's fever broke, and the gray membranes in her throat began to dissolve as her immune system, aided by the antitoxin, fought off the infection. Timothy, breathing easily through his tracheotomy tube, showed steady improvement in his overall condition. By the end of the week, Kate had achieved what many physicians would have considered impossible. She had controlled a diphtheria epidemic in an isolated frontier community with minimal resources and no specialist support. Of the 18 confirmed cases, she had lost only 1 patient, an elderly man whose advanced age and poor health had made recovery unlikely even with optimal treatment. As Kate prepared for the return journey to Milbrook, she reflected on how much had changed during the crisis. For the first time since leaving Boston, she had practiced medicine without hiding her knowledge or disguising her capabilities. The mining families had accepted her as their physician, grateful for expertise that had saved their children's lives. But Kate also understood that her open practice of medicine during the epidemic would have consequences beyond Copper Creek. Word of her success would spread throughout the territory, potentially reaching the ears of officials who were already investigating her irregular status. The woman who had hidden her medical degree to work as a frontier nurse had finally practiced as the physician she'd always been meant to be. The question now was whether the territorial authorities would see her success as vindication of her competence or as further evidence of illegal medical practice that demanded prosecution. As their wagon descended toward Milbrook, Kate knew that the epidemic had changed everything, but whether those changes would secure her future or destroy it remained to be seen. The real test would come when Territorial Health Inspector James Crawford learned that the unlicensed woman physician he'd been investigating had just successfully managed a major disease outbreak while the licensed male doctor had been unable to function effectively. Kate's medical triumph might prove to be either her salvation or her downfall. depending on how the territorial medical establishment chose to interpret her unprecedented success. News of Kate's triumph at Copper Creek spread through the Colorado Territory faster than she could have imagined. Within 2 weeks of her return to Milbrook, riders were arriving from mining camps as far as 50 miles away, seeking the woman doctor who had stopped a diphtheria epidemic that could have killed dozens of children. But with recognition came scrutiny, and Kate soon discovered that success could be as dangerous as failure for someone in her precarious position. The first indication of trouble came from an unexpected source: Dr. Jonathan Whitmore, a prominent physician from Denver who arrived in Milbrook unannounced on a cold November morning. Unlike Territorial Inspector James Crawford's bureaucratic investigation, Dr. Whitmore represented the medical establishment itself, the professional community that had the power to destroy Kate's career permanently. Kate was treating a minor's infected hand wound when Margaret Henderson burst into the clinic with barely concealed panic. "Miss Sullivan, there's a doctor from Denver asking questions about you all over town. He's been to the hotel, the general store, even talked to Father Santos. People are saying he's here to make trouble." Dr. Hartwell, who had been resting in his office due to increasing fatigue, emerged with obvious concern. "Margaret, what kind of questions is this doctor asking?" "About Miss Sullivan's credentials, her medical training, whether she's been practicing independently. He seems to know all about what happened at Copper Creek." Margaret's voice carried the protective loyalty that had characterized the community's response to coup challenges to Kate's position. Kate felt her stomach drop as she realized the implications. Someone had reported her success at Copper Creek to the territorial medical community, probably framing it as evidence of illegal practice rather than life-saving expertise. Dr. Whitmore's presence meant that the informal tolerance she'd enjoyed was about to be tested by official medical authority. "Dr. Hartwell," Kate said quietly, "I should meet with Dr. Whitmore directly. Avoiding him will only create more suspicion." Dr. Hartwell nodded, though his expression showed deep concern. "Miss Sullivan, be very careful what you say. Dr. Whitmore has connections throughout the territorial medical establishment. His report could influence whether the medical board takes action against us." Kate found Dr. Whitmore waiting in the hotel's small dining room, reviewing a thick folder of documents while sipping coffee that had long since grown cold. He was a man in his 50s with graying hair and the confident bearing of someone accustomed to professional respect. His expensive clothes and polished demeanor marked him as a representative of urban medical sophistication, far removed from frontier practicalities. "Dr. Whitmore, I'm Catherine Sullivan. I understand you wanted to speak with me." Dr. Whitmore looked up from his papers with the appraising gaze of someone conducting a professional evaluation. "Miss Sullivan, thank you for coming. I'm investigating reports of irregular medical practice in this community. Specifically, allegations that you've been performing physician-level care without proper licensing." Kate seated herself across from him, maintaining composure despite her racing pulse. "Doctor, I work as Dr. Hartwell's medical associate, providing care under his supervision and with community approval. Miss Sullivan, I've reviewed testimony from 18 families at Copper Creek who describe you performing independent medical procedures, making autonomous diagnostic decisions, and essentially functioning as their primary physician during a serious disease outbreak." Dr. Whitmore consulted his notes before continuing. "These activities go far beyond any recognized nursing role." Kate realized that the family she'd helped had unknowingly created evidence against her by accurately describing the medical care she'd provided. Their gratitude had become testimony for a potential prosecution. "Dr. Whitmore, emergency conditions sometimes require flexibility in professional roles. My actions were necessary to save lives when conventional medical protocols couldn't address the crisis we faced. Miss Sullivan, necessity doesn't override legal requirements for medical licensing. The state of Colorado grants medical licenses to ensure public safety by verifying practitioner competence. Operating outside that system, regardless of your intentions, undermines the integrity of medical practice. Dr. Whitmore opened his folder and placed Kate's forged nursing certificate on the table. Furthermore, my investigation has revealed irregularities in your nursing credentials. This certificate appears to have been issued by an institution that has no record of your attendance. Kate felt the walls closing in as her worst fears materialized. Dr. Whitmore hadn't just discovered her unlicensed medical practice. He'd uncovered the fraudulent documentation that had made her employment possible in the first place. Dr. Whitmore, Kate said carefully, I can provide documentation of my medical education that demonstrates my qualifications to provide the care I've been delivering. Medical education obtained where? Dr. Whitmore's tone suggested he already knew the answer. Kate made the decision to stop hiding behind partial truths. Johns Hopkins University School of Medicine. I graduated with full medical credentials 3 years ago. Dr. Whitmore's eyebrows rose with surprise. Johns Hopkins? That's a prestigious institution. Why would someone with a Johns Hopkins medical degree be working as a frontier nurse under assumed credentials? Kate found herself explaining, for the third time in as many months, the barriers facing women in medicine and the impossibility of practicing as a female physician in established medical communities. But Dr. Whitmore's reaction was different. From the sympathy she'd received from local supporters, Miss Sullivan, while I understand the challenges facing women in medicine, deception is not an acceptable response to professional barriers. The medical profession maintains standards precisely because lives depend on practitioner competence. When you circumvent those standards, you undermine public trust in all medical care. Dr. Whitmore gathered his papers before delivering his verdict. I'll be recommending to the Territorial Medical Board that they pursue formal charges against you for practicing medicine without a license and obtaining employment through fraudulent documentation. Dr. Hartwell will also face disciplinary action for supervising unlicensed practice. Kate felt the devastating finality of professional destruction settling over her. Unlike local political opposition, which could be negotiated or overcome through community support, formal medical board action would end her career permanently and possibly result in criminal prosecution. Dr. Whitmore, Kate said desperately, what about the lives that were saved? The children at Copper Creek who would have died without proper medical intervention. Doesn't successful patient care matter more than bureaucratic compliance? Miss Sullivan, successful outcomes don't justify illegal methods. If we excuse unlicensed practice because it happens to work out well, we open the door to charlatans and incompetents who cause tremendous harm before their inadequacies become apparent. After Dr. Whitmore left, Kate returned to the clinic feeling as though her world was collapsing. The success that had felt like vindication now seemed like evidence for her own prosecution. She had saved lives, demonstrated exceptional medical competence, and earned community respect, but none of that mattered to professional authorities who valued regulatory compliance over practical results. Dr. Hartwell was waiting for her with obvious anxiety. Miss Sullivan, how did the meeting go? Kate described Dr. Whitmore's investigation and his intention to pursue formal charges. As she spoke, she watched Dr. Hartwell's face reflect her own dismay at the severity of the threat they faced. Miss Sullivan, Dr. Hartwell said quietly, I want you to know that I take full responsibility for this situation. I knew about the irregularities in your credentials, and I chose to work with you anyway because I believed in your competence. Kate shook her head firmly. Dr. Hartwell, you've supported me when no one else would. I won't let you sacrifice your career for decisions that were ultimately mine. Their conversation was interrupted by the arrival of Mayor Patterson, followed closely by Margaret Henderson, Tom Bradley, and Father Santos. The group's grim expression suggested they'd already heard about Dr. Whitmore's investigation. Miss Sullivan, Mayor Patterson said without preamble, we need to discuss how to respond to this threat. The entire town council is prepared to fight any attempt to remove you from our community. Margaret Henderson nodded emphatically. We've been talking to families throughout the area, people you've treated, lives you've saved. There's strong support for keeping you here regardless of what Denver physicians think about your credentials. Tom Bradley stepped forward with the blunt directness that characterized his approach to problems. Miss Sullivan, far as we're concerned, you're the best doctor this territory's seen. Anyone who wants to prosecute you for saving lives can answer to us first. Kate felt touched by their loyalty, but she also understood the limitations of local support when facing territorial legal action. I appreciate your confidence, but Dr. Whitmore represents authorities who can override local preferences. Community support might not be enough to protect me from formal charges. Father Santos, who had been listening quietly, finally spoke. Miss Sullivan, there may be options we haven't considered. I've been corresponding with colleagues in Santa Fe and Denver about territorial medical regulations. The legal situation might be more complex than Dr. Whitmore suggested. Kate looked around at the group of people who had become not just her supporters, but her friends. Their willingness to fight for her, despite the risks to themselves, represented everything she'd hoped to find when she came west, seeking a place where her medical skills would be valued over her gender. What are you proposing? Kate asked. Father Santos smiled with the confidence of someone who had discovered useful information. I'm proposing that we challenge Dr. Whitmore's interpretation of territorial medical law. The regulations governing frontier medical practice are different from those in established urban areas. We might have legal grounds to argue that your practice has been appropriate for local conditions. Mayor Patterson leaned forward with interest. Father Santos, are you saying we can fight this legally? I'm saying we can try. But it would require Miss Sullivan to present her case formally, with full documentation of her medical education and a detailed record of her successful patient care. She would have to practice openly as a physician and defend her qualifications before territorial authorities. Kate realized that Father Santos was proposing exactly what she'd been avoiding since arriving in Milbrook: open practice as a female physician, with all the risks and challenges that entailed. But the alternative, losing everything she'd built, while accepting defeat without a fight, was unacceptable. Father Santos, Kate said with growing resolve, what would this legal challenge require? First, formal documentation of your medical education from Johns Hopkins. Second, detailed patient records demonstrating successful outcomes under your care. Third, testimony from community members about the quality and necessity of your medical services. Dr. Hartwell straightened with renewed energy. Miss Sullivan, I'll provide complete documentation of our partnership and my assessment of your medical competence. My professional reputation may be damaged, but it's worth risking to establish a precedent for qualified women in frontier medicine. Kate looked around at the faces of people who were willing to risk their own standing to support her right to practice medicine. For the first time since Dr. Whitmore's arrival, she felt hope that the crisis might become an opportunity rather than a catastrophe. If we're going to fight this, Kate said with determination, we need to do it completely. No more hiding, no more deception, no more pretending to be anything other than what I am: a physician who came west to practice medicine and found a community that needed her skills. The decision to fight marked the beginning of Kate's final transformation from the woman who had hidden her medical degree to work as a frontier nurse into the physician who would openly challenge the territorial medical establishment's right to exclude qualified women from medical practice. The battle ahead would test not only her medical competence, but her courage to claim her place in a profession that had never intended to include her. The Territorial Medical Board hearing that would determine Kate's fate took place on a bitter December morning in Denver, in a courthouse that represented everything she'd been fighting against since leaving Johns Hopkins. The imposing stone building, with its formal chambers and intimidating legal atmosphere, seemed designed to crush individual challenges to institutional authority. But Kate Sullivan was no longer the frightened woman who had hidden her medical degree to work as a frontier nurse. She was a physician prepared to claim her rightful place in medicine, whatever the cost. Kate entered the hearing room accompanied by an unlikely delegation from Milbrook, Dr. Hartwell, despite his worsening condition, Mayor Patterson in his best suit, Father Santos carrying a leather portfolio thick with documentation, and Margaret Henderson representing the community that had rallied to Kate's defense. Behind them came 12 other townspeople who had traveled 2 days to testify about the medical care that had saved their lives or their children's lives. The 3-member Territorial Medical Board sat behind an imposing mahogany table, their formal robes lending gravity to proceedings that would determine not just Kate's future but the precedent for women's participation in frontier medicine. Dr. William Harrison, the board chairman, was a distinguished man in his 60s whose silver beard and penetrating gaze suggested decades of experience in medical authority. Flanked by Dr. Charles Morton from Colorado Springs and Dr. Samuel Evans from Pueblo, he represented the conservative medical establishment that had never envisioned women as professional equals. Dr. Jonathan Whitmore sat at a separate table with his evidence against Kate, documentation of unlicensed practice, testimony about her independent medical decisions, and proof of the fraudulent nursing credentials that had enabled her deception. His confident demeanor suggested certainty that the board would uphold traditional standards and punish Kate's violations accordingly. This hearing, Dr. Harrison announced formally, will determine whether Catherine Sullivan has violated territorial medical practice laws and what disciplinary action, if any, should be taken. Dr. Whitmore, please present your case. Dr. Whitmore rose with practiced authority, laying out the charges against Kate with methodical precision. He described her unlicensed practice, her fraudulent nursing certificate, and her assumption of physician responsibilities without proper territorial certification. His presentation was thorough, professional, and devastating in its implications for Kate's future. Members of the board, Dr. Whitmore concluded, Ms. Sullivan's violations represent a fundamental threat to medical practice standards. She has performed surgery without supervision, made independent diagnostic decisions that required physician-level training, and essentially operated a medical practice while deceiving authorities about her credentials. Regardless of her educational background or patient outcomes, allowing unlicensed practice sets a dangerous precedent that could undermine public confidence in legitimate medical care throughout the territory. Dr. Harrison turned to Kate with a formal courtesy that barely concealed his skepticism about her presence in his chamber. Miss Sullivan, how do you respond to these charges? Kate stood, wearing her finest dress and carrying herself with the dignity she'd learned through months of proving her competence under impossible circumstances. Her voice was steady as she began what would be the most important speech of her life. Dr. Harrison, members of the board, I admit that I came to Colorado without proper territorial licensing. But I came as a fully trained physician who was denied the opportunity to practice medicine legally because of my gender, not my qualifications. I hid my credentials not to deceive patients, but to serve them when no other qualified medical professional was available. Kate opened her portfolio and placed her Johns Hopkins diploma on the evidence table. I graduated summa cum laude from one of the nation's most respected medical schools. My professor's recommendations attest to my clinical competence and surgical skills. I completed rotations in surgery, internal medicine, obstetrics, and pediatrics. I passed every examination, met every requirement, and earned honors that placed me in the top 5% of my graduating class. The only difference between my qualifications and those of any licensed physician in this room is that I am a woman. Dr. Morton leaned forward with obvious skepticism. Miss Sullivan, professional standards exist for legitimate reasons. Medical licensing protects the public from incompetent practitioners who might cause harm. If we excuse violations based on individual circumstances, how do we maintain the integrity of medical practice? What prevents every charlatan from claiming special circumstances? Kate had prepared for this challenge. Dr. Morton, I understand the importance of professional standards, but territorial law already recognizes special circumstances for frontier medical practice. Remote communities often lack access to licensed physicians and must rely on whatever qualified medical personnel they can find. My practice in Milbrook served that exact need, providing physician-level care to a community that had been underserved for years. Father Santos rose to present documentation he'd spent weeks gathering from territorial law libraries and government offices. Honorable board members, territorial medical regulations specifically allow for emergency medical practice when licensed physicians are unavailable. Section 47 of the Territorial Medical Code states that qualified medical personnel may provide necessary care during emergencies when no licensed physician is reasonably available. Dr. Hartwell's deteriorating condition created exactly that situation in our community. Dr. Hartwell, summoning strength despite his obvious physical limitations, addressed the board with the professional respect one physician owed to another. Gentlemen, I must be honest about my own condition. I have been diagnosed with progressive neurological deterioration that increasingly limits my ability to provide the complex medical care our community requires. Miss Sullivan's arrival allowed me to continue serving our patients while ensuring they received the skilled treatment they deserved. Her medical knowledge and surgical skills exceed those of many licensed practitioners I've known throughout my career. Dr. Evans interrupted with sharp interest. Dr. Hartwell, are you saying you deliberately collaborated with unlicensed practice because of your personal medical limitations? I'm saying, Dr. Hartwell replied firmly, that I recognized exceptional medical competence when I saw it, and I prioritized patient welfare over bureaucratic compliance. Miss Sullivan's intervention during the diphtheria epidemic at Copper Creek saved 18 lives that would have been lost without her expertise. No licensed physician was available to handle that crisis. Miss Sullivan was the only person with the knowledge and skills to prevent a catastrophic outbreak. The testimony that followed transformed the sterile legal proceeding into something far more powerful, a demonstration of how medical competence translated into human lives saved and community health protected. One by one, the families Kate had treated told their stories with emotional impact that no legal argument could match. Tom Bradley described the mining accident that should have cost Peter Mackenzie his leg, explaining how Kate's surgical skill had required hours of delicate bone reconstruction and nerve repair. That woman doctor didn't just patch Pete up, she rebuilt his leg so good, he's back working the mines. Don't matter to us what papers she's got. What matters is she knew how to fix what was broken when no one else could do it. Maria Gonzalez, speaking through Father Santos as translator, testified about the emergency surgery that had stopped her hemorrhaging when delay would have meant certain death. Dr. Sullivan saved my life when I was bleeding to death, and no other help was coming. She worked for hours to stop the bleeding and repair the damage. In my country, we call such people angels of God, sent to heal the sick and comfort the suffering. Mrs. Patterson spoke about Elizabeth's poisoning and Kate's immediate recognition of strychnine toxicity, describing how Kate had administered antidotes and supportive care that required extensive toxicological knowledge. Miss Sullivan didn't just save my daughter's life, she explained every step of the treatment, taught us what to watch for, and made sure we understood how to prevent similar accidents. That's the kind of thorough, caring doctor any community would be blessed to have. The most powerful testimony came from Timothy Patterson, now 8 years old and breathing easily through his healed throat. His small voice carried clearly through the formal chamber as he described the emergency tracheotomy that had saved his life. Miss Sullivan made it so I could breathe again when I was choking and turning blue. She cut a hole in my throat so air could get to my lungs, and then she took care of me until I got better. She saved my life, and my mama says she saved lots of other kids too. Sarah Patterson, Timothy's older sister, added her own perspective. Dr. Sullivan explained everything to us kids so we wouldn't be scared. She told us about germs and how medicine works and why we needed to stay away from sick people. She made learning about staying healthy seem important instead of scary. Bill McKenzie, the Copper Creek camp supervisor, provided detailed testimony about the diphtheria epidemic and Kate's systematic response. Miss Sullivan didn't just treat sick people, she organized our whole camp to stop the disease from spreading. She set up isolation areas, taught us about sanitation, and made sure every family understood how to protect themselves. Without her knowledge and leadership, we would have lost half our children to that epidemic. As witness after witness testified to Kate's medical competence and life-saving interventions, the formal atmosphere of the hearing began to shift. Dr. Harrison and his colleagues found themselves confronting not abstract questions about licensing compliance, but concrete evidence of exceptional medical care that had transformed an entire region's health outcomes. Jake Williams, the prospector who had first brought news of the Copper Creek epidemic, addressed the board with the blunt honesty of frontier life. "Gentlemen, I've seen a lot of doctors in my time, and most of them weren't worth the paper their licenses were printed on. But Miss Sullivan, Dr. Sullivan, she's got something special. She cares about people, she knows her business, and she gets results. That's what matters in country like this." Margaret Henderson spoke as both a businesswoman and a mother whose family had benefited from Kate's care. "Dr. Sullivan has treated my nephew's chronic respiratory condition, helped deliver my sister's difficult birth, and provided medical consultation for dozens of families in our area. Her diagnostic skills identified problems that other practitioners had missed, and her treatments consistently produced successful outcomes. Our community's health has improved dramatically since her arrival." Dr. Evans, who had remained silent through most of the proceedings, finally spoke with obvious internal conflict. "Miss Sullivan, your patient outcomes are undeniably impressive, and the testimony about your medical knowledge demonstrates exceptional competence. But the law requires territorial licensing for medical practice. How do you propose we reconcile your undeniable qualifications with your violation of established regulations?" Kate realized this was the moment that would determine everything, not just her own future, but the possibility that other qualified women might someday practice medicine openly in frontier communities. She had prepared for this question through weeks of study and reflection. "Dr. Evans," Kate said with growing conviction, "I propose that this board recognize what frontier communities have already discovered. Medical competence matters more than bureaucratic compliance when lives are at stake. My education from Johns Hopkins equals or exceeds that of any territorial physician. My patient outcomes demonstrate successful medical practice under challenging conditions that would test any practitioner's abilities. The only barrier to my licensing has been a prejudice that serves no legitimate medical purpose." Kate pulled out a thick folder of meticulously documented patient records that chronicled every case she'd treated during her time in Milbrook. These records show systematic, competent medical care that meets or exceeds standards for frontier practice. I've documented diagnoses, treatment plans, patient responses, and outcomes for every individual I've treated. I'm not asking you to excuse violations. I'm asking you to acknowledge that those violations were necessary to provide medical care that no licensed physician was available to deliver." She continued with passion that had been building for months. "This territory needs qualified medical practitioners willing to serve remote communities under difficult conditions. Excluding women from practice reduces the pool of available physicians and forces communities to go without adequate medical care. I've proven that gender doesn't determine medical competence, results do. Dr. Whitmore rose to object with obvious frustration. Board members, Miss Sullivan's arguments amount to claiming that individual circumstances justify ignoring professional standards. This sets a dangerous precedent that could undermine medical authority throughout the territory. If we allow unlicensed practice based on claimed competence, we open the door to charlatans and incompetents who will use similar arguments to justify their violations. But Father Santos was prepared with a response that surprised everyone present. He had spent weeks researching territorial law and precedents for irregular medical practice. Dr. Whitmore, territorial medical law already recognizes precedents for irregular practice under special circumstances. Section 47 of the Territorial Medical Code allows for emergency medical practice by qualified personnel when licensed physicians are unavailable. Miss Sullivan's practice clearly falls within that provision. Dr. Harrison consulted the Territorial Medical Code, frowning as he read the regulation Father Santos had cited. Father Santos, this provision refers to temporary emergency care, not ongoing medical practice spanning multiple months. With respect, Dr. Harrison, Father Santos replied with the diplomatic skill that had made him an effective community mediator. The provision doesn't specify duration limits for emergency care. In a frontier community lacking adequate medical resources with the only licensed physician suffering from progressive disability, the emergency could be considered ongoing until proper medical coverage is established. Miss Sullivan didn't create this situation. She responded to it with the medical training she possessed. The legal argument that followed revealed the complexity of applying urban medical standards to frontier realities. Kate listened as lawyers, physicians, and community representatives debated whether her practice violated territorial law or fulfilled its intended provisions for emergency medical care. The discussion extended for over an hour, with board members asking detailed questions about frontier medical needs, licensing procedures, and the practical challenges of providing healthcare in remote areas. Dr. Harrison called for a recess while the board deliberated. During the tense waiting period, Kate found herself surrounded by the people who had traveled from Milbrook to support her. Their presence reminded her that whatever the board decided, she had found what she'd come west seeking: a community that valued her medical skills over her gender, that judged her by her contributions rather than her compliance with discriminatory standards. Dr. Hartwell, despite his exhaustion, took her hand with paternal affection. Miss Sullivan, regardless of what they decide, you've already won the most important victory. You've proven that women can practice medicine as competently as men, and you've forced the medical establishment to confront their own prejudices. When the board reconvened after 90 minutes of deliberation, Dr. Harrison's expression was unreadable. The chamber fell silent as he prepared to deliver the verdict that would determine Kate's fate and potentially establish precedents for women's participation in territorial medicine. Miss Sullivan, Dr. Harrison began formally, this board has considered all testimony and evidence presented during these proceedings. We find that your medical education from Johns Hopkins University is exemplary, that your clinical competence has been demonstrated through successful patient outcomes under challenging conditions, and that your medical practice in Milbrook has met high standards for frontier healthcare delivery. Kate felt her heart racing as she waited for the verdict that would determine her future. The pause seemed endless. However, Dr. Harrison continued, we cannot overlook the irregularities in your initial credentials and your practice without proper territorial licensing. These violations represent serious breaches of professional protocol that cannot be dismissed lightly. Kate prepared herself for the professional destruction she'd been fighting to avoid. Therefore, Dr. Harrison announced, this board rules as follows. First, we find that Miss Catherine Sullivan possessed the medical qualifications and demonstrated the clinical competence to provide the care she delivered, even though she lacked proper territorial certification at the time of her practice. Second, we recognize that frontier communities may require medical practice arrangements that differ from urban standards, particularly when licensed physicians are unavailable or incapacitated. Third, we hereby grant Ms. Sullivan a provisional territorial medical license, contingent upon successful completion of territorial medical examinations within 6 months. Kate felt the room spinning as the implications of the board's decision sank in. They weren't prosecuting her. They were licensing her as a territorial physician. Furthermore, Dr. Harrison added with obvious significance, this board recommends that territorial medical regulations be modified to accommodate qualified physicians who can demonstrate competence through examination and practice outcomes, regardless of gender, when frontier communities lack adequate medical coverage. We also recommend establishing formal procedures for evaluating and licensing qualified women physicians who wish to practice in territorial jurisdictions. The hearing room erupted in celebration as Kate's supporters realized what had happened. She had not only avoided prosecution, but had secured legal recognition as a territorial physician. More importantly, the board's decision created precedents that could open frontier medical practice to other qualified women throughout the American West. Dr. Whitmore gathered his papers with obvious disappointment, but he approached Kate before leaving with grudging professional respect. Miss Sullivan, I still believe you violated established professional standards, and I continue to have concerns about the precedent this decision creates. But I cannot argue with your patient outcomes or your obvious medical competence. I hope you use this opportunity responsibly and that you prove my concerns unfounded. Kate accepted his acknowledgement with grace and understanding. Dr. Whitmore, I intend to continue providing the best medical care I can to communities that need it. That's all I've ever wanted to do, practice medicine where it can make a difference in people's lives. The journey back to Milbrook felt like a triumph parade, with Kate's supporters celebrating not just her personal victory, but the broader principle that had been established. Father Santos had secured legal recognition for the proposition that medical competence mattered more than gender when frontier communities needed physician care. Dr. Hartwell, despite his exhaustion from the trip, expressed deep satisfaction that his partnership with Kate had been vindicated. Miss Sullivan, Dr. Sullivan, you've accomplished something remarkable that extends far beyond your personal situation. You've forced the medical establishment to acknowledge what frontier communities already knew. Good medicine is good medicine, regardless of who provides it. You've opened doors that will benefit women physicians for generations to come. Back in Milbrook, news of Kate's licensing spread quickly through the mining camps and settlements throughout the region. Within weeks, she was receiving requests for medical consultation from communities that had never had access to physician-level care. Her practice expanded to serve not just Milbrook, but a network of frontier settlements that valued medical competence over traditional prejudices about women's professional capabilities. The sign outside her clinic was repainted to read Dr. Catherine Sullivan, physician and surgeon, marking the end of her deception and the beginning of her open practice as the frontier doctor she'd always been meant to be. But more than personal vindication, Kate's victory represented a transformation in how frontier medicine could be practiced, and who could practice it. As she settled into her new role as a licensed territorial physician, Kate reflected on the extraordinary journey that had brought her from hiding her medical degree to defending it before the Territorial Medical Board. The woman who had been afraid to reveal her qualifications had become an advocate for expanding medical practice beyond traditional barriers and discriminatory limitations. Dr. Catherine Sullivan had finally found her place in medicine, not despite being a woman, but as a physician whose gender became irrelevant in the face of her competence, dedication, and courage to fight for the right to heal. The frontier had taught her that true medical authority came not from institutions that granted or withheld permission based on prejudice, but from the lives saved and the communities served by those brave enough to practice medicine where it was needed most. Her story became a beacon for other women who would follow, proving that with sufficient skill, determination, and community support, even the most entrenched professional barriers could be overcome. The frontier nurse who had hidden her medical degree had become the frontier doctor who opened doors for generations of women physicians who would never have to hide their qualifications again. Up next, you've got two more standout stories right on your screen. If this one hit the mark, you won't want to pass these up. Just click and check them out. And don't forget to like, subscribe, and turn on the notification bell so you don't miss any upload from us.